In this segment, I'm going to talk about what autism is, and mostly from the perspective of how autism impacts individuals. So how it interferes with a person's ability to learn new things, new academic skills and language and social skills and independent living skills. And I'm going to talk about those for the most part and not about diagnostics. So for example, if you're a parent of a child and you suspect that he or she may have autism, then clearly this isn't thorough enough. This isn't an assessment. This isn't intended to be a diagnostic tool. You need to see an MD or your psychologist. So let me start by kind of mentioning, in general, there are three things that impact most people with autism the most. And two of those are deficits, so things that people with autism don't do enough of, and one relates to excesses, or things that people with autism do too much of. And so we have to work on trying to reduce those behaviors. And I'll talk about each of those three in more detail. The first is related to language and communication. Many people with autism have fairly broad deficits related to their ability to communicate with other people and in many cases even understand language or communicative behavior. And of course this varies from a mild impairment to very severe. There are of course some people with autism who struggle to communicate at all and who may have very little ability to understand the communication of others. So let's start with this first one, related to communication. In many cases, there's little or no verbal communication. And as a behavior analyst, I make a distinction between verbal behavior and vocal behavior. So, of course, vocal behavior is speaking, but verbal behavior is communicating with other people. And it can include speaking, of course, but also things like sign language or a picture exchange system or a communication device. These are all ways that we could communicate that aren't necessarily vocal. And those encompass a range of verbal behaviors. And so many people with autism have little or no verbal communication. And of course, not only does that make it difficult to communicate with people, but that tends to pervade every other area of that person's life. So it affects his or her ability to participate with peers, both when you're talking about children and adults. So for adults, obviously, you have to interact with peers at work and at home and various other places, leisure activities. And if you're a child, obviously, you need to interact with peers to play and learn and participate in classrooms and so forth. And not being able to communicate obviously affects that. But it also often impacts other behaviors, in many cases even inappropriate behaviors, or in some cases even severe behavior, and I'll talk more about that. But that communication deficit also affects your ability, or a child or an adult's ability to learn new academic and cognitive skills. So the verbal communication deficits impact everything. And that's why some of the best interventions typically include, if not emphasize, language acquisition. It's important for people with autism to acquire new skills related to communication. Also, the second bullet here relates to bizarre speech patterns. So many people with autism exhibit vocal or verbal behavior that is, well, for lack of a better term, bizarre. And the example that I've listed here is echolalia, which is basically repeating things back. In some cases, this may be immediate. So, for example, if I said, "What is this?" instead of answering, "It's a remote," you might say, "What is this?" And that would, of course, be echolalia. And sometimes it's more delayed. So, if I were a child with autism, I might repeat back favorite sounds or lines or scripts from preferred cartoons or television shows. Now, echolalia in and of itself, or speech patterns that are like this in and of themselves, are not necessarily atypical, or they don't necessarily differ from how typically developing kids acquire language and sort of expand their language repertoire. So as all of us learned language, we exhibited some echolalic behaviors, right? So if I'm at the zoo and I point at a lion and my 2-year-old is with me and sees me do that, I point at a lion and say, look, a lion, and he points at it too and says, a lion. Well, that's echolalic behavior. He's just repeated back what I've said. But that's part of an interaction with me. That's part of one learning incident for my 2-year-old, and he's interacting with me, and it's clearly within the context of our interaction. In many cases, people with autism exhibit this behavior not as a part of an interaction, and not necessarily in the context of that interaction, but in many cases it's what we refer to as self-stimulatory behavior. So in fact, they like how it sounds or how the words feel coming out of their mouth. And it's very difficult to learn new things. So it's not necessarily furthering that person's skills or sort of acquisition related to some particular task. And of course, many of our kids with autism exhibit echolalia much more often than their peers. So as a part of typical language development, clearly that's not all you're doing. But it's going to be hard for me to teach you that this is a remote if you always respond, if I say, what is it? And you respond by saying, what is it? So we'll talk a little bit more about this, but that can impair or impede a person's ability to learn and a person's socialization, right? So it's difficult for me to interact with peers if I'm exhibiting quite a bit of echolalia. So that impacts in those areas. The next bullet point here relates to something that's often referred to as prosody. These are ways that we communicate other than just our words. So pitch, stress, volume, rhythm. These communicate to other people, or we can use these things to communicate with other people. And this can be difficult for kids with autism to use and for them to understand. So for example, if I said, oh, this segment is today, that means something different than if I say, oh, this segment is today, right? And most of you understand that, but it's difficult for kids with autism to understand that prosody has meaning. I can tell you in a moment of sort of self-deprecation that I try to communicate meaning to my children with volume, and they don't have autism, but it doesn't work very well with them either. And then this last one, or the second to last one here, has to do with more complex interaction or more complex language, having conversations with other people. And for those with autism, even if they've developed some language abilities, maybe they've learned how to answer some simple questions and label people and items, and they can request preferred activities and so forth. They've started to develop a bit of a language repertoire. Even for those people, conversational skills can be difficult. And generally for a couple of different reasons. One is that our conversations tend to be very fluid. There's no script for a conversation that I might have with anyone, frankly. We might start with a few common conversational topics. If I met someone at a party, I might say, what is your name? Where are you from? What do you do for a living? How do you know our host? Those sorts of conversation starters. But then, of course, they could go any number of different directions. The way that you respond depends on my question, and then my next response depends on how you responded to that first question. So, of course, they quickly get very complicated. And for you and I, we can tend to do that. We can have a conversation without a script. But for many people with autism, that's just too sophisticated. It's just too difficult. And in some cases, to be honest, even for a person that has the ability to do that, sometimes the interest isn't there, right? So even if you can have a conversation with me, you might not be interested in doing so. Most of us have learned to pretend right? So if I start talking to someone here and they start talking about Georgia football, for example, I'm not particularly interested in that, but I can pretend. I can fake it. Oh, yeah, I saw that they won Saturday, and aren't we all so happy because of it? Most people with autism haven't learned the ability to pretend like they're interested. If they're not interested, they just won't participate in that. And then the flip side is many people with autism have restricted interests, or in some cases even interests that are unique, often to a great extent. So those of you who know someone with autism, I'm sure many of you can describe situations where people with autism like very obscure things. I have a kid who is into antique fans, and evidently there are other people like this. The internet has really changed how we perceive these things, but I'm not that interested in having conversations about antique fans. Now, he can have a conversation about antique fans for hours, surprisingly, and it's maddening. I mean, it will just literally put you to sleep. He'll do that, but he has a hard time having a conversation with me about anything else for 30 seconds because he's just not interested. So the narrow interest often interferes with a person with autism's ability to have conversations. And then lastly, related to language and communication is, in some instances, people with autism even have great difficulty understanding the language of other people. Right, so not only might he or she be unable to express him or herself to other people, but he or she might not understand what other people are saying. And of course, that's going to impact just about every area of that person's life. So these are all ways in which a communication or language deficit impacts someone with autism. These are all impediments to progress, frankly, to learning all the things that that we need people with autism to learn to be as independent as possible. And so a good intervention program addresses all of these things. And so we'll talk about that when we get to the segment that has to do with ABA. But we have to, for each person, assess where they're at in all of these areas and have, in most cases, pretty intensive programming to address these issues. Okay, so that was language. Another area of deficit that is fairly common among people with autism relates to social skills. And the first that I have listed here is a lack of eye contact, facial expressions, or gestures. Many people with autism have trouble with those things. And eye contact is the one that comes up quite a bit. In some cases, people with autism will even actively avoid eye contact. And of course, that's a social or interactive behavior that we engage in. We use eye contact to indicate interest and attention and so forth. And we use that amongst listeners to gauge their interest and attention and so forth. And people with autism have trouble with that. We also communicate with facial expressions and gestures. And again, people with autism have trouble with that, both expressively or using those things, but also receptively understanding what those things mean. And in many cases, because of that, they even seem unaware of the existence of other people. So if you have someone with autism who has difficulty with the first three things there, and they also have severe language deficits, that presents as though that person is unaware of the existence of others. And this, of course, is quite troubling among parents in particular. Many people with autism also lack peer relationships. So if you look at the third bullet there, this is certainly true of adults, but it's also true of young children. And even in groups of children, say on the playground or in a classroom when most of the kids are playing, it's not uncommon that a child with autism doesn't interact with other kids. So you may have heard the term parallel play before. So it's not interactive play, they're sort of engaging in parallel play. You have a kid with autism who's playing, and with the other kids, they're sort of breathing the same air that they are, but not interacting with the other kids. And as you might imagine, of course, communication plays into that, and interest plays into that. But in many cases, one of the other things that impacts peer relationships is a learning history. So even a kid with autism who, say, was diagnosed fairly early and began to receive a variety of interventions, hopefully some applied behavior analysis, but maybe also speech language pathology and occupational therapy, say that that kid was getting services and began to make progress, began to learn and participate in those various interventions, and that kid is acquiring skills, including language. And one of the skills that that kid is undoubtedly acquiring is learning that it's valuable to interact with adults. So if an adult stops him and says, "Josh, sit down," that there's value in doing that, listening to what that adult says and responding accordingly has a history of reinforcement. So when I've done these things in the past for adult instructors, it's paid off for me. In many cases, there's not this history with peers, right? So if I'm a 4-year-old with autism, it's not uncommon that the other 4-year-olds don't have access to any of my reinforcers. They don't have the things that I want. My speech therapist has the things that I want. My ABA specialist has the things that I want, but the 4-year-olds don't, and therefore there's not a good value in interacting with them or responding to them or trying to participate with them or engage them in any way. And this is beyond the scope of what we're talking about in this segment, but one of the best interventions for changing peer behavior or social behavior among children with autism is changing the behavior of their peers. Equipping their peers with some of their reinforcers and teaching peers how to ask again and prompt and sort of move around in front of Josh, and really providing treatment to peers changes the way or changes the value of them in the eyes of that person with autism. So this is also something that's fairly common. There are some pretty interesting treatments for it, and it is something that can be taught, but it usually doesn't just pop out of nowhere. It's not something that can just be acquired by breathing the same air as typically developing kids. And if you look at the second to last one here, lack of sharing enjoyment, attention, or experiences with other people, you'll sometimes hear this referred to as joint attention. People with autism have trouble with these types of things. And in particular, joint attention is receiving a lot of attention in the last several years, or maybe even as far back as many years ago, but it's become very popular to try and change, in part because people with autism often have this deficit, but also researchers have discovered that we can change it, that we can change the joint attention of people with autism. And when we do things like point, right? If I see something and point at it, in essence, that's a social behavior. I'm pointing at it because I'm trying to draw your attention to what I've pointed at, or to the item at which I've pointed. So it's a social behavior. I don't point at things when I'm alone, right? If I'm driving down the interstate alone, I don't point at things because it's a social behavior. There's nobody with me, or and if I'm pointing at things, then maybe I should see a psychologist. But I also engage in joint attention by what I look at, the language that I use. Did you see that? Right? If I see something interesting and say, "Did you see that? Was it just me, or was she acting weird?" And I do that because I understand you may have experienced it differently. Right? You might not have seen it, or maybe I misinterpreted it. I'm interested in your point of view, right? I understand that you have a different perspective than I do, and people with autism often don't. So it's often difficult for people with autism to put themselves in others' shoes, or take the perspective of other people, or have empathy for other people. And then lastly, there's often also a lack of play skills, things like imitating peers, pretending And if you really think about it, isn't pretending such an odd behavior? I mean, this doll, this plastic, we're going to pretend that it's a baby, and we're going to pretend to feed it, but we're going to feed it other pieces of plastic, right? Or we're going to take this tiny little piece of metal that's shaped like a fire truck. It represents a fire truck, and we're going to drive it to this house that's just sitting here, and it's also made out of plastic. We're going to pretend that it's on fire. We're going to take the guys and and we're going to put out the fire. Well, this type of pretending it's kind of odd when you think about it, and most kids just do it, right? Typically, developing kids just pretend. We don't typically teach typically developing children to pretend, but what we find is that for children with autism, we generally do have to teach them to do this behavior. It's a valuable tool to use with their peers, to use with other children, because that's what the other kids are doing. Okay, so that's kind of a summary of some areas of social behavior that are typically impediments for people with autism. I also want to talk about excesses. So those first two things relate to things that people with autism don't do enough of, that intervention has to identify and teach and strengthen. But as you know, there are also often areas of excess, things that people with autism do too much of that it may be important to reduce. One of those includes abnormal sensory or motor behavior, or repetitive behavior, what's technically referred to as stereotypy. And colloquially, this is sometimes described as self-stimulatory behavior. Now, this isn't always true, because self-stimulatory behavior refers to function. That means that I engage in the behavior because I like how it feels or sounds, or the stimulation that I get from it. And in many cases, that's true of repetitive behavior, but some repetitive behaviors may be for other purposes, right? Maybe for avoiding tasks, or for getting attention, or for communicating with other people to get preferred items or activities. And in those cases, it's not actually self-stimulatory behavior. It may look the same, the form of the behavior may be different, but the function is different. Now, that said, in many cases, it actually is self-stimulatory, but it's not uncommon that people with autism engage in quite a bit of this behavior. Hand flapping, rocking, these are the examples of motor behavior. And also, in some cases, you get vocal self-stimulatory behavior, repetitive vocal behavior. I might have a particular sound that I like. These all, of course, aren't necessarily different than the rest of us. We all have some repetitive behaviors, some, again, for lack of a better term, self-stimulatory behaviors. So you might tap your foot or fidget with a pen as you sit and listen. The difference, though, is that when we engage in these types of behaviors, we can often still learn, right? So I can fidget with this, but still pay attention to you. I can still listen to what you're saying to me. You can teach me a new thing. I can attend to your instruction and respond to your instruction. It's not interfering with that. I'm still engaging in this behavior, but it doesn't have all of my attention. And most of the repetitive behaviors that we all engage in aren't necessarily as pronounced, right? So if I'm tapping my foot, that's probably not going to prevent someone else in the room from interacting with me. For people with autism, self-stimulatory behavior can often be consuming, right? So I'm a kid with autism, I'm playing with a rubber band, and I can't listen to you, or won't listen to you while I'm playing it. I can't acquire a new skill. I can't participate in instruction while I'm engaging in this behavior. And if it's very pronounced, if I engage in hand flapping behavior, that might interfere with socialization, because it might prevent approaches, natural approaches from other kids or peers. So of course, these would be reasons why we would want to decrease behavioral excesses. If these types of behaviors interfere with learning or interfere with socialization, that's a good rationale for intervention that seeks to decrease those behaviors. Now, that being said, if you know someone with autism who engages in repetitive behavior, he or she probably does so because he or she likes it. And so I tend to operate from the notion that we need a reason to reduce it. You don't just say that's an autistic behavior, so we're going to try and reduce it. It needs to interfere in some way. If it doesn't interfere, if you have some control over it, for lack of a better term, then you don't necessarily need to take it away. You don't necessarily need to intervene to reduce that behavior. In fact, in some cases, it can even be helpful. So I have a little boy who likes to play with rubber bands, but you can say, you know, we're not going to do that right now, and he can put it away and not get very upset about it. And then there are some cases where it's okay, right? It's okay to play with rubber bands. That doesn't interfere much with socialization, and if you can tell him it's time to put it away, then it doesn't really interfere with learning. There are some cases where it's valuable to his parents to be able to let him have a rubber band so he can do things like wait in line or wait for his food in a restaurant. So while these things occur, we really need a reason to take them away, and we often do, don't get me wrong, but that should sort of be the starting point. And then also, the second point here, people with autism often have a preoccupation with objects as opposed to people. So as a person with autism, I may prefer to interact with things instead of with other people. And related to that, I may have fairly restricted interests. There may only be a handful of things that I want to play with. I don't have this broad repertoire of toys and activities that I can do, maybe just one or two. Not surprisingly, that can be a big impediment, and not to mention a problem for parents in particular. If I'm a kid that basically can't do anything on my own, that requires a great deal of supervision and intervention, and that can be a pretty big burden for families. And then lastly on this one, people with autism often have issues related to non-functional routines, or what we would often refer to as ritualistic behavior, or rituals, right? So we all have some rituals in which we engage. I like to get coffee first thing in the morning. I have a morning ritual, check my emails. I like to get them to an even number. Even if I can't get them to 0, I like to get them to an even number, preferably one that ends with a 4 or 2. And that's a ritual for me. It's not functional. It doesn't serve any purpose. There's no reason why I need to have 14 emails instead of 17, but it's something that I want. That's my ritual. The difference is those rituals don't necessarily interfere with my life. So if I can't get my emails to 16 or 14 or 12 in an ideal world, I'm not going to have a tantrum. Right? I'm not going to hit anybody. I'm not going to start spitting or hitting my head. In many cases, when you interrupt the ritual or non-functional routine of someone with autism, it becomes very upsetting. They have to do that. When I come into this room, I have to touch this 3 times and straighten this remote so it's just so, and have the screen at just the right angle. And if you try and interrupt that, it's very upsetting to me. And so it's not hard to imagine how that interferes with a great deal of learning and socialization. So that sort of ritualistic, or what some people would describe as OCD behavior, is an impediment to learning. And then lastly, many people with autism exhibit a variety of behavioral excesses like crying, screaming, aggression, and in some cases even self-injury, which sometimes can be quite severe. It can be dangerous, and as can physical aggression or property destruction. At the very least, things like crying and screaming can be mildly annoying at best and quite interfering at worst. And I think that people often have a tendency to ascribe these behaviors to autism itself, right? So this person has autism, so they're aggressive as a result, or he hits himself because he has autism. And while language is certainly related to autism, it's part of the disorder, most of these types of behaviors are learned. They get shaped up as opposed to being symptomatic of the disorder itself. And what I mean by that is people with autism learn that aggression or self-injury or property disruption, tantruming behavior, they learn that these behaviors work pretty well. They become functional. They become more functional than their appropriate alternatives. And so on the slide you can see here kind of a silhouette of Rain Man and his brother. There's a famous scene in the movie where they're trying to fly to Los Angeles, and Rain Man doesn't want to get on the plane. And he starts by saying, you know, Delta 481 crashed on November 8th, 1972, or whatever it might have been. And his brother's saying, well, that's okay, you know, we can pick another airline, we'll pick American. Well, there was an American Airlines flight that crashed whenever. And finally he says, all airlines, Ray, all airlines have crashed at one time or another. And there's the funny line where Raymond says, Qantas has never crashed. I don't know if that's true or not, but it's certainly funny in the movie. So he's clearly communicating he doesn't want to fly. So his brother's like, you know, I'm not flying to Australia to get to Los Angeles. So he grabs him and says, come on, you and me are going to get on the plane. He starts to drag him to the plane. At this point, Rain Man starts to scream and hit his head. So right there in the terminal, he just drops everything, screams, and starts engaging in self-injury. And as you might imagine, his brother just says, okay, we're not going to fly. And so he spends the next few seconds saying, it's okay, we're not going to fly. We were going to fly, but you know, we're not going to. It's all good. And then they walk off, and the movie ensues with their, you know, road trip and all that. Now, the point that I'm trying to make is Ray has appropriate, albeit kind of odd, behavior to get what he wants. In this situation, what he wants is not to fly. And he has a way to communicate that to his brother. It's odd, but it's there. He has enough language to describe that he doesn't want to fly. And his brother clearly understands what he's trying to communicate and ignores all of it. I don't care, we're getting on the plane. But as soon as he starts screaming and hitting his head, that works, right? That behavior ends up working better than language. So in this particular case, his self-injury and screaming is very functional. It works better. And what happens over many and many of those experiences is someone with autism learns that that's the best way to behave, for lack of a better term. These behaviors tend to work better. So as another example, if I'm a 4-year-old in a classroom and there's a peer of mine, we're in pre-K, and there's a peer that has a toy I want, well, even if I have, which I probably don't, but even if I have sophisticated social and language behavior, and I can go to that boy and say, you know what, I'd really like your toy right now. Can I play with that now? Can I have a turn with your toy? Well, in some cases that might work, right? Some 4-year-olds might say, sure, that's fine. I mean, I was playing with it, but okay, you can have it. In my experience, 4-year-olds will just say no. You know, if I didn't want this toy, I wouldn't be playing with it. So that really awesome language and social behavior doesn't get reinforced every time. Well, if I'm really sophisticated, I might find an adult in the room. I might approach a teacher or a paraprofessional and say, you know, Michael has a toy that I want right now. Can you help me get it? And there may be instances where the teacher says, you know what, yeah, he's had it for a while. It's your turn. I'm going to go get it. But there are certainly going to be some where the teacher says, you know what, he has it. Michael has that toy right now. You need to learn how to share, or you need to learn how to wait. When Michael's done, you can have it. So I may have engaged in all of this fantastic behavior, and sometimes it might get reinforced, but certainly sometimes it might not. And not because any of the actors in my play here have ill intentions, but because that's just the way human behavior is. Now, if I really want that toy, the most effective thing to do is walk over to Michael and kick him and take the toy, right? That's going to work every time. Now, the first couple of times I do that, Michael might come after me. But if I'm really aggressive, Michael's going to learn when I approach, drop the toy and run, right? So that creates this history of this is a pretty effective behavior. Now, Michael might even go to the teacher and tell the teacher, Coby hit me, or Coby kicked me. And the teacher may come over, if he or she has time to drop everything and go deal with this, he or she may come over to me and get the toy back and give it back to Michael. But if we have a history, it's now February, not September, if we have a history, that teacher may also want to avoid my tantrums because I can tantrum, right? It's not just a kick. I can go berserk for an hour. And I can scream and have an accident right in the middle of the floor in front of everybody. And so maybe that teacher also wants to avoid that. Teachers learn that, he or she doesn't want to deal with Coby's big tantrum. So in some instances, at least, that teacher might say, Michael, I know, and that is a fantastic toy, but let's let Coby have a turn, and then as soon as he's done, I'll get it, and you can have it back. So both in the short term and the long term, that aggression can serve to work pretty well. And there's nothing about my autism that made me kick Michael. I've just learned that it works very well. Now, of course, the implication of that is because it's learned behavior, we can also teach alternatives. We can change it. We can implement intervention that will change this behavior. We can engineer environments to make more positive behavior or alternative positive behavior more functional. We can make other things work better, thereby changing or reducing these excesses. Okay, just a couple of other things that I want to mention. Those are that's kind of an overview of those excesses and deficits, how they impact learning, and again, in another segment, we'll talk about how we, in applied behavior analysis, have to address all of those things. But I did want to just mention one quick thing. So as recently, really, as the 90s, autism was still fairly rare. And you can see if you look at this chart that the incidence rate has, since 2000, been climbing fairly significantly. In fact, if you look at the incidence rate, 1 in X children, so it starts at 1 in 150 children, and in 2008 it was 1 in 88. And in fact, in March of this year, 2013, the most recent numbers indicated that it's now 1 in 50. Now there are, of course, lots of issues that we could talk about related to this data and what it may be due to. Is that incidence or prevalence rate due to, awareness or better diagnostics? Probably, at least in part, whether that's a small part or a large part is, again, another discussion. The implications for us are there are many more people diagnosed with autism today than ever before. And this number continues to rise, and it, of course, has implications for our healthcare industry, for education as a whole, and in fact, it gets very expensive. So these numbers really get outdated every year, if not even every day, but this is probably a conservative estimate. We probably spend at least we collectively in the United States probably spend at least $35 billion with a B dollars every year just to keep our heads above water treating autism. And believe me, everybody with autism doesn't get as much treatment as they need. And if they did, it would probably even be a lot higher than that. In fact, the individual lifetime costs likely exceed $4 million. That's per person over a lifetime, just to provide services for someone with autism. In fact, in public schools in 1992, you can just see some of the rise from 92 to 2005. Some of the special ed statistics indicate that there were about 15,500 children with autism in public schools in the United States. And that rose to almost 200,000 by 2005. And of course, that was almost 10 years ago. That number is dramatically higher than that even now. Now, just real quickly, there are also some things that we know about effective treatment of autism, or the sort of intervention that people with autism need. So this is from the National Academy of Science, and in essence what they did is look at a variety of programs that provide intervention for children with autism, and then compared what those interventions included, and then reported on the commonalities among them. So these are kind of broad, and these are just common components, and obviously it varies on an individual basis, but these are some things that are generally important for people with autism. The first is that a person with autism gets early entry into a treatment program. So one of the things that can be most predictive of success is when someone gets into treatment or starts receiving intervention as early as possible. In fact, probably as soon as it's even suspected that that child may have an autistic spectrum disorder. Now, that commonality leads many people to ask, is there any age that's too late? Right? So is there sort of this threshold at which intervention becomes less or not effective? If my kid is X years old, is it too late to do anything? And the answer to that question, not surprisingly if you're still listening, is no. In fact, there is a wealth of research literature related to intervention for a variety of developmental disabilities that indicates we can make dramatic treatment gains with adults until death, frankly, even retirees. We can take people with significant developmental disabilities, even in advanced years, and teach new skills, reduce inappropriate behavior, that basically address all of those things that I just mentioned. Now, it may be the case that if we start early, we can, for lack of better terms, sort of get more bang for our buck, but there's no age at which you can't still make meaningful impacts. It's also important that intensive instructional programming includes at least 5 days a week. You can think about it like a full-time job, right? So if you look at, I guess it's the third bullet point here, at least 25 hours a week of intensive intervention. And you'll hear various numbers about what this needs to be and what is considered intensive intervention. In some cases, it's more like 30 or more hours per week. But it basically needs to be a full-time job. In essence, this kid needs meaningful, deliberate, precise instruction all day, every day. And the more, it tends to be the case that the more that you can provide, the better. And this is also important, the second and last bullet, a full year of programming, and then the last one, 12 months a year. What is also a common component of effective intervention is that there are no large breaks. So there's no summer for kids with autism. They don't get to take off June and July and not participate in any intervention or education. They don't get to just do nothing during June and July. In fact, my kids don't get to do nothing during June and July. But for people with autism, they pretty much need intensive programming all the time. Or at least what we know is that when we provide that, that's the best way to make meaningful progress. We also know that one-on-one and very small group instruction to some extent is crucial. Again, based on where an individual kid is, sort of their baseline, his or her baseline, this can vary. How much should they be getting one-on-one? How much should they be he or she be participating in groups? But clearly, one-on-one and or small group instruction is going to be more effective and more efficient at teaching new skills. And depending on how severely impaired a particular kid is, they may have a lot of catching up to do. So there needs to be at least some of this. Training and support for family members is critical. Family members need to know how to teach new skills, how to deliver instruction with precision, how to reinforce appropriate behavior accurately, how to not reinforce inappropriate behavior, how to develop new programs, how to generalize what I've learned in this situation to other situations. Parents, siblings, family members who interact with this particular student need training and ongoing support related to those things. Because as I said, round-the-clock intervention is critical, and when they can participate in that or sort of add to that, it's going to be better for the person with autism. And then it's also important that there are mechanisms for ongoing evaluation and assessment of the individual's progress. So you'll see in the segment on applied behavior analysis that it's critical that we are constantly evaluating, okay, where is this kid now? How does that affect what we're trying to teach? Have they learned this? Do they need to learn a new thing? Should we prompt a little bit less? What's the next step up? What's the next most complicated skill? What makes sense to teach next? How do I fade some of the prompting and support that I've added in? Where are we at today? Where are we at tomorrow? Where are we in 6 months? This sort of precision measurement and evaluation of our effects is crucial to provide precision treatment. And in one of our other segments on evidence-based practice, I'll talk about why, or in a little bit more detail, why that's critical. All right, so that concludes the segment on autism and kind of an overview of how it impacts children and adults with autism. So if you have any questions, you can, of course, go to either of these websites and email me or frankly, just the information directly with any questions or comments. Thank you.